Thank you, Patrick. Welcome to the last presentation. And this last presentation will be done by Benson Ameda. Benson Ameda is a veterinary technician with 36 years working experience in Kenya Public Service. He has experience in animal health care and veterinary public health. Benson, who is also the president of Africa Veterinary Technician Association, has a vast experience in veterinary policy and legal reviews. He currently is a director with the Kenya Veterinary Board that regulates practice and training of veterinary practitioners in Kenya. He was a member of World Organization for Animal Health ad hoc group that developed the veterinary paraprofessional minimum competency and curricular guidelines, and is currently the OA VPP expert. His commitment in serving humanity has earned him a numerous recognition, including member of the Order of Golden Warriors of Kenya by the Republic of Kenya. Welcome, Benson.
Thank you very much. I hope you can see my screen. I'll just proceed. Now, what I'm going to present is about the experiences of VPP regulation in Kenya. In other words, we are talking about where now the rubber meets the road, where the standards actually, how they are actualized in real life situation. And as I do this presentation, I think it is in order that I also recognize the presence of the regulator, the registrar and CEO of Kenya Veterinary Board, who is amongst their participants. Now, my presentation will go through, we look at the population of VPPs and the roadmap of VPPs that the VPPs took in Kenya, Veterinary Surgeons and Veterinary Paraprofessionals Act, pre-training requirements, and the regulations and the practice of veterinary surgeons and veterinary paraprofessionals. The first VPP was trained in Kenya by the government of Kenya in 1965. And this training was actually meant that the VPPs were to support government service. So all of them were actually being trained to be absorbed by the government. The automatic absorption into the public service was ceased or stopped in 1988 after the privatization of veterinary clinical services and AI services. The first welfare association was created in 1995 to work on the legal recognition of VPPs. You remember immediately the immediate absorption or the automatic absorption of VPPs into government stopped. Then the VPPs realized that there was a need and they formed a VPP association to work on that. In 2011, the Veterinary Surgeons Act was repealed and replaced by VS and VP Act, Veterinary Surgeons and Veterinary Paraprofessionals Act, that is currently in force. The Act established Kenya Veterinary Board, which is the VSB, to regulate both the training and the practice in Kenya, both for veterinarians and for the VPPs. VPPs are now required to register with the Kenya Veterinary Board and with their professional association. Sometimes we say that being a member of a professional association is not mandatory, but in Kenya, for you to be registered as a practitioner, then you are also expected to be part and somebody participating within the professional angles. And this has definitely improved veterinary services in Kenya. The population has grown. I think I've talked of 9,000. There is actually now going to 11,000. And 28% are in government employment or public service. About 70.5% are in the private sector, and a paltry 1.5% are working with the non-governmental organizations. So the population of livestock in Kenya is, as you can see on the screen, And just take note that these figures are from the 2009 census, because this census was actually the first after a very long time to be conducted, and it was done very accurately. And therefore, I decided to go to those figures of 2009. Now, what is the roadmap? How did all this happen for us to change the laws? During the late 1980s and early 90s, there were structural adjustment programs. And this resulted into the freeze of automatic employment. So when this happened, yet VPPs were still being trained, they were not being regulated, and they could not belong in any organization, then they formed an association, the VPP Association. As I've said earlier, normally associations are formed to address needs. And at this time, VPPs realized there was a need for them to be allowed to practice legally. So the veterinary authorities then strongly opposed this intention. And in fact, the chairman of the association then was interdicted in 1994. In some countries, whenever you are trying to form an association, it may be confused to be political, that you may be having different interests, and therefore it is rarely understood well. So when the chairman was interdicted in 1994, those who remained still continued agitating for that registration. And in 1995, the association was legally registered. In 2002, there was a formation of a committee to review Veterinary Surgeons Act so that VPPs can be brought on board. And the VSB then organized a small committee that was composed of Kenya Veterinary Association, Faculty of Veterinary Medicine, Directorate, and the Association of VPP, so that they can discuss and agree on how to move forward. Then during this time, the committee agreed on Veterinary Practitioners Bill. They wanted now to join, repeal Veterinary Surgeons Act, and come up with Veterinary Practitioners Bill. In 2006, unfortunately, the Veterinary Association in Kenya, which was part of the committee, disowned, walked away from the process, arguing that VPPs are not practitioners, and therefore they cannot propose or they cannot support a bill that places VPPs as practitioners. Now, during that stalemate, therefore, in 2009, the VPP sponsored their own bill, Animal Technicians Bill, through a private member of parliament, and the bill was actually supported by all members of parliament. The reason for this is that everybody wanted every person practicing to be regulated at whatever level. You are being regulated at the level of your training. So all members of parliament supported that, and actually it was passed. However, as most of us know, it is the president to assent to any bill that has left parliament. So during this time, given that the minister did not support Animal Technicians Bill, the president rejected to assent, but gave some amendments that should exclude health and food safety from the Animal Technicians Bill. So later it went to parliament, and those two were excluded from the bill. So the Animal Technicians Bill passed by parliament with amendments on condition that the Minister of Livestock tables another bill to include VPPs. And I think this one was again in the interest of VPPs, because their interest was to be regulated in whatever form. So the minister actually tabled a bill, Veterinary Surgeons and Veterinary Paraprofessionals Bill, in 2010 December. And in less than 2 months, that bill was passed that include VPPs. So the VSVP bill was passed, and there were still some issues, and the VPP associations petitioned it, and later there were so many conflicts between the VPPs and the veterinarians at that time. But in 2013, the VSVP Act was fully operationalized after it had left court. Now, what is happening now? You see, during the process, there were resistance from other stakeholders. But you see, what is happening currently, there is a much more enhanced collaboration between veterinary surgeons and veterinary paraprofessionals in Kenya. VPPs and vets are working together. In fact, we have cases where veterinary surgeons have sponsored awards for VPPs, and even currently, to organize World Veterinary Day, the vets and the VPPs are actually in the planning committees. So it has really improved on the collaboration. Employers are demanding for registered VPPs. That's an added advantage, which was not known when there was resistance. There is immense growth in training institutions. Initially, there were only 4 training institutions in Kenya, but now we are talking of over 20. This has improved the public-private sector participation and has also encouraged more professionals to be in training. VPPs are involved in decision-making at the board level. In the current board in Kenya, VPPs are part of the decision-making body. They are there with the veterinarians and they work together making decisions at that level. It's different from a VSB regulating VPPs without the involvement of VPPs. In Kenya, VPPs are involved. Employment opportunities for both vets and VPPs in the board. VPPs are now being employed in the board, vets are being employed, and it has actually improved also in ensuring that more vets and practitioners are employed. Establishment of continuous learning mechanism. Now, VPPs are able now to continuously learn and be updated in the new changes and the new with the new technology that comes up in the world. So there are a lot of benefits which were only realized after having the new VSVP Act. Construction of a KVB headquarters. Initially, KVB was stationed or was hosted by the Directorate of Veterinary Services in a very small room. And I think this happens in a number of countries. And they are complaining that the government is not providing resources to the regulator. But as we know, government cannot give resources in an organization that has 100 people. Now, the Kenyan government has realized that with thousands and thousands of practitioners registered, they are now supporting the construction of a KVB office. And in this construction, the VPPs and the vets are actually making decisions. It is not the vets doing it alone. And that is what is now the KVB headquarters in Kenya. From a very small room with 2 staff, no vehicle, no parking, no nothing. In fact, it's like they were all volunteers. Today, if you come to KVB headquarters, it's a massive building that they can even assist other institutions also to have the offices there. So this has come because of the regulation of both VPPs and veterinarians. The definition of VSVP Act is as there. It provides for the training, the regulation of training, registration and licensing of both vets and veterinary paraprofessionals. Some of the parts of or the sections of VSVP Act, we are talking of the establishment of Kenya Veterinary Board, provisions related to registration and practice by registered persons, finances, inquiries and disciplinary actions, offenses and penalties. You may realize in a number of countries in the veterinary legislation that we have, they may be having all those other parts, but there is no offense. They assume it's just like a document. In Kenya, there are sections for offenses and penalties. So The first speakers had talked of primary legislation and secondary legislations. And here you can see that Veterinary Surgeons and Veterinary Paraprofessionals Act has actually provided for the regulations. And the first one is VSVP Regulations 2013, where we have now regulations of elections of board members. How do board members become board members? How are they elected? Regulations on training and registration, registration of institutions and other organizations. Okay, standards and veterinary clinics, training institutions, and so on. The second regulation, we also have regulations for the code of ethics for VPPs and veterinarians. So these ones are not in the main legislation, but the main legislation provides for the establishment of these regulations. How do we handle animals, the premises, the professionalism, and so on. And finally, we have regulations on Veterinary Medicines Directorate. This is also under the VSVP Act. So the Veterinary Medicines Directorate actually regulates veterinary medicines, gives it powers, regulations on manufacture, importation, registration, and so on. Who can prescribe, who should be in a pharmacy, and all those. Now, categories of VPPs in Kenya, I think this one I'll go very fast. We have two categories, veterinary technologists and veterinary technicians. Technologists have degrees and diplomas, and technicians have certificates. Pre-training requirements. In Kenya, the VSB or Kenya Veterinary Board requires that even before you go to a training institution, they must have a say whether you will be trained or not. So even thinking of going to do certificate, you must first be sure that you have a grade like C- and also a C- in biology. So it is not just having a grade, because we have cases where somebody has passed very well, but he has done religious education, history, geography, physical education, things which may not be required for you to have the right competencies. And diploma, degree, the same, their requirements. For institutions, for an institution to train VPPs, it has also to be accredited by KVB. So KVB has to be sure that that institution has the capacity, the right classroom, physical infrastructure. They have the nurse, the right trainers, the number of vets, the farm, and all those infrastructure, including the laboratories. So after that, then KVB will accredit that institutions to train.
Benson, can you wind up in the next 2 minutes?
Yes, I'll do that. Thank you. Indexing by Kenya Veterinary Board. The moment you are going to be trained, you have just left high school, you are joining a training institution to be trained, KVB starts marking you. Already you are indexed. KVB gives you a number which will follow you up to your graduation. And this one helps when an institution is deregistered or recognized, then the students or the trainees can be moved to other institutions. So that is done by KVB, and it is a must for all students joining training, both certificate, diploma, and degrees. Period of training, I think that one I've mentioned. Internship is also a program that when everybody have graduated, all trainees are given opportunity to be on internship, where they are actually given some kind of allowances or remuneration by the government. And this one helps them also to start off. So internship is mandatory before you are registered to practice as a VPP or as a vet surgeon. Then, of course, all those will be required for registration as members. CPD is mandatory for both VPPs and veterinary surgeons. And CPD you can acquire from going to a training college or attending such courses. Those are services provided for by VPPs under the under the supervision of a veterinarian. There are procedures like closed castration, open castration of pigs and so on, those ones can be done. Roles, some of the roles that VPP does, you can see there on the photos. And thank you very much for listening.
Thank you.